The Prime Minister and Chancellor had hoped the budget would help steer the economy into calmer waters. But this morning, Boris Johnson was asked why, this year of all years, it had not included a pay rise for healthcare workers.
We've invested already in the health and social care sector huge quantities throughout the pandemic, and I think the whole country is massively grateful to healthcare workers and social care workers for what they have done.
In fact, the Prime Minister and Chancellor were about to be ambushed on the issue, perhaps unwittingly, by the Department of Health. This afternoon it emerged they were recommending a pay rise for NHS workers of 1%. Given the year that your members have had, what do you think of 1%?
Well, I think it's pitiful and I'm bitterly disappointed. I think that nursing staff coming off of a shift, tired and already demoralised, working hard, will be heartbroken and angry.
Although inflation was just 0.9% last year, the OBR tentatively anticipates it will be 1.5% this year and 1.8% next, making a 1% pay rise, yes, a real terms pay cut. And after all the heartfelt gratitude directed towards NHS workers, they had hoped for something more tangible.
NHS workers up and down the country have been working so hard. They've been making sacrifices for the past 12 months. We entered the pandemic with 100,000 staff deficit. And I think that the Health Secretary clearly has no intention of fighting for us, despite what he says. He clearly thinks that clapping and wearing a badge saying care is enough. Well, it's not.
A government spokesman said 1 million NHS staff are already benefiting from previously agreed pay deals, and newly qualified nurses have already had a 12% pay rise. But Labour say today's pay recommendation is symptomatic of a wider funding gap.
Our NHS is under intense pressure. Patients are waiting longer for cancer care, for mental health care, for an operation. Our NHS needed more resources yesterday, and they didn't get it. Rishi Sunak has failed patients, he's failed the NHS, and he's failed NHS staff.
Today, the Chancellor's spending plans were branded implausibly low by the Independent Institute for Fiscal Studies, and the government will face intense pressure to do a lot more heavy lifting for the NHS and other public services. Carl Dillon, News at 10, Westminster.